I'm Chastity, and I'm here to perform the NG2 insertion, lavage, and gavage. First, my safety practices. I want to verify my doctor's order, hand hygiene. I will verify the facility procedures. I'll look at manufacturer's notes for any equipment to be used. I'm going to knock on the patient's door, identify with 2 identifiers. I'll note their overall condition of the patient, and then I'll draw my curtain for privacy and explain the procedure. I'll raise the bed for good body mechanics. Then I'll put on appropriate PPE. Once I'm done with my procedure, I will lower the bed back, give them a call light. Then I will report and record the procedure and how it went. And also, if I were to do an IV push, my clinical instruction needs to be there. Also, for this procedure, we are administering Lucerna, so the 6 rights for med administration. The right patient will get the right medication, the right dose, right route, right time, right documentation, right indication. So, the first thing I would do for my NG2 is assess, do a full focused abdominal assessment. I will also want to assess the nares to see which one is more patent. You can touch your finger to a clue. So we're going to use this nair right here. Poked her, but she's alright. So after I assess the nares, I'm going to get my tube and measure. So I'm going to go from the tip of the nose to the earlobe to her xiphoid. And then I will mark that with either marker or tape. Once I got that marked, I can get my lube and lube 3 or 4 inches. And then we'll go ahead and insert. I'm going to have her tilt her head back. So her head's back. I'm going to go ahead and insert. And I'll insert until it gets to the oropharynx. And then I will look in her mouth to make sure there's no coiling. If she was coughing, pull back a little bit until it subsides. So there's no coiling. Now I'm going to have her flex her head forward and continue to advance. And it's at the predetermined mark. I'm going to hold it and temporarily secure it. So while it's there, I'm going to either check pH of the stomach contents or get an x-ray to confirm placement. Once I've done that, then I can go ahead and secure it. So I'll get my tape. And then I'm going to have her turn her head side to side. And then I'll get a safety pin and rubber band. And secure it to the gown. And once it's all connected to her, I'm going to go ahead and connect it to low intermittent suctioning. And connect it and turn it on. Okay, and then I'm going to document which nair I put it in, how she tolerated the procedure, and all that. So now we have another order for gastric lavage. And before I start the lavage, I'm going to check for placement, either using the x-ray or pH test, according to whatever the facility says. So we know it's in the right spot, so I'm gonna go ahead and disconnect. Turn it off. And according to the order, we need to use 9% 0.9% normal saline. So here's my saline. Just kidding. All right, got my saline. Put it in. Let that run through, and then I'm going to aspirate out some contents, put it in the basin, and I'll do that until it runs clear. Then I will go ahead and hook her back up to suction if she needs to, or just clamp it. And after I did the lavage, I'm going to take my contents and assess it and measure and document what I did. Okay, after the lavage, I'm going to go ahead and administer her Lucerna, her doctor's order. She is getting 100 milliliters with a 50 milliliter flush. So I'm going to unclamp her. I'm going to hook this up. And then I'll get my flush, 50 ml, pour that in. And then administer that 18 inches above the site. Crank it back. I'm gonna wipe off my Lucerna label, shake it up, make sure it's right. And then I'll administer the 100 ml. And once that goes through, I'll clamp it again, 50 milliliters, and let that run through. And she's tolerated it well, but before I give her the feeding, I would have checked the residual. So I would aspirate the contents, make sure it's less than 150, and then give her the feeding, which it's less than 150, so I gave her the feeding. And then once I've done with the feeding, then I can go ahead and document